everyone, I am Dr. Arva Bhavnagarwala. I am a pediatrician practicing in Mumbai since the last 5 years. I am really glad to be a part of Pink Talks, a new initiative by the Pinkish Foundation. Today, I'll be talking about a few topics on care of a newborn baby. So now, let me first begin with swaddling or maintaining the temperature of your newborn baby. Babies are too small to maintain their body temperatures on their own. Their body temperatures change as per the environment. If the ambient temperature in the room is too cold, they will become cold easily. Or if it is too hot, they will heat up really fast. So how can we prevent that from happening? Now, we cannot have radiant warmers in our homes which are used in the hospitals to maintain the body temperatures. It's not practical. So the easiest way to maintain the body temperature would be wrapping your baby up. Now, this can be a bit tricky if your baby does not like it. And in fact, it's very common these days as well. So nothing to worry. You can wrap your baby as long as he or she likes to be wrapped in. Like for example, a few babies only like their legs to be wrapped. They want their hands to be free. That's perfectly alright. You need not force them into swaddling. Otherwise, they'll become more irritable. Now, what are the benefits of swaddling? Number one, it makes your baby feel safe, like as if the baby is in the cocoon, like how it was in the mother's womb. Number two, it helps them to sleep peacefully. They don't get startled when they are swaddled properly. And rest well, that would be the mother's choice, and depending on how the baby is comfortable with the wrapping around him or her. Now, let's talk about massaging the baby. Now, massaging is something which is again a bit feared by the mother because they are like, my baby is too small, what if something goes wrong? And that fear is rational. Massaging is not compulsory. You do it if you wish to do it and if your baby enjoys it. Usually most babies in the initial few days, they do not like being massaged. They cry a lot. But now let me tell you what are the benefits of massaging. Massaging helps in improving the blood circulation in their body. Sometimes it also helps in strengthening of their bones and it promotes good sleep. Another important thing is if the mother is massaging the baby, the process of massaging helps in the mother-infant bonding. Now the mother cannot massage immediately after birth. Maybe after a month or so, the mother can start massaging the baby. Now how do you massage? Do you rub the baby and make them cry more? No, you will use gentle yet firm strokes. Massaging circular motions over the chest and massage the hands, the legs, right? And what oil will you use for massaging? Please do not use mustard oil or rai ka tel as it is known. That causes many reactions in the baby. The skin erupts in rashes. That is the most common thing observed. So avoid that. You can use any commercially available oil that is hypoallergenic, fragrant free. Or the best oil in my opinion is using a coconut oil. Pure coconut oil. Warm it a bit and then you can use that for massaging your baby. Now, another important aspect in the care of the newborn is feeding, breastfeeding and formula feeding. Now, one thing we should all know about breastfeeding is breast milk has two types. The first part that comes out is known as the foremilk. That is watery and it satisfies the baby's thirst. The later part of the breast milk that comes out is called the hind milk. That is rich in fats and that satisfies the baby's hunger. So it is important to feed the entire foremilk and the hind milk before switching over to the next breast. If you switch over very often, you will be only giving the baby foremilk. The baby will be perpetually hungry, keep crying and will not put on weight. And then you will be worried, what is wrong with my baby? So when you're feeding your baby, take at least 15 to 20 minutes per breast before switching over to the other side. That will make yours and your baby's life much simpler. Alright? And if by any chance the breast milk is not sufficient, the mother can always give formula feeding. There is no harm in doing that. Make sure you mix the feed as per the instructions on the box. You may prepare it under hygienic conditions, sterilize the bottles regularly. Nothing will go wrong with that. Now, a few problems that are associated with feeding that most commonly mothers complain. First is vomiting. Now, a little bit of curdled milk coming out after feeding is normal. Nothing to worry about that. Some mothers say that the baby vomits a lot, like after every feed and almost multiple times in a day. Now, here the thing to be kept in mind is vomiting may occur sometimes due to overfeeding, or sometimes the baby is not well, or any such thing. Now, if the vomiting is causing inadequate nutrition in the baby is not gaining weight, then that needs to be addressed. A few occasional episodes of vomiting here and there, it's alright. Not to worry about that. Okay? And another thing is burping. Now, most babies refuse to burp. I'll give you my example. I'm a mother too. My older one would never burp. I used to keep him upright 10-15 minutes, pass him on to the other members of the family, but no, he would refuse to burp. So what I used to do is I would keep him down, slightly propped up or elevated by placing a firm pillow beneath his head and shoulders and slightly tilted towards the left side. After about 10 to 15 minutes, usually within 15 minutes, he would again wake up crying. And when I would lift him up at that time, he would burp. And then he would be comfortable and sleep. So this is just a small technique. It may not work, depends on your baby. Some babies burp very easily, not fussy at all. Whereas some like these, they just refuse to burp. So this is a technique. If they don't burp, you can keep them elevated and slightly in the left lateral position. Burping is important. Why? Because they swallow a lot of air while feeding. Hence, they feel uncomfortable if we don't burp them. And even if they don't burp, but they are comfortable, then please do not worry about that. I hope my video has been of help to all my audience. I'll be coming back with another video soon. Until then, goodbye and thank you very much.